say that we have a that will reduce taxes for families and for small business, and also to reduce red tape in our platform, and everybody can check out that.
Sure, because my throat's been dry. I mean, I think Andrew Corbett and the NDP party have put together a very mature discussion, and it involves reducing corporate tax cuts so that money can be available for proper social spending.
2 quick things. One, tax policy is very critical because we don't have national economies or trade barriers, and capital and people are highly mobile, and regional economies fall into crisis very quickly. 11% job recovery in the United States, 124% in Ontario, 320,000 jobs created in Ontario in the last 2 years, a record. Very critical, and that's the most important thing. Well, that's how many lost? There were 240,000 lost in 2008. So that gives you an idea of the recovery, and 80% of those jobs are described as high-value jobs by economic thinking. That's a remarkable recovery, unique right now in the Western world. So tax policy, I don't want to get the long boring conversation, is important to incenting and maintaining jobs. All you have to do is read the conservative literature about me, and all that answers your question. But it's interesting to me in this following way. My grandmother came to this country from Ukraine. She always used to say to me, "Glenn, never complain about your taxes. They're the price of civilization." Her 2 brothers were killed in a Nicene, endless civil war in that country. She had no education and no health care. We have built a remarkable education system. We are rebuilding our health care system. And we have done that without raising taxes on people. But we have rebuilt the tax base of this province very, very substantially. I think that's really cool.
Hi. I used to work at Central Neighborhood House. I was a housing worker for seniors. I worked with very poor, vulnerable seniors. And I had a number of clients who were homeless. These are people in their 60s, 70s, sometimes 80s, and they were homeless. And the really heartbreaking thing is they weren't necessarily homeless because of lack of income, because normally they're eligible for the federal seniors benefits. They were homeless because they had mental health issues and/or senility issues, and they could not maintain a home on their own. And I found it next to impossible to find housing for this population, because supportive housing for seniors, especially for seniors with mental health and/or senility issues, is practically non-existent. So we do have a chronic population of homeless seniors. And first of all, I want to know, are you aware of this problem? It's not a problem I hear discussed or talked about very much. And also, if elected, what would you and your party do about this, if anything?
I'm very aware of it. I think I was pretty shocked when I first saw it as a street nurse in clinics at Dixon Hall, seeing Korean War vets and World War II vets, and it's only recently the research has been done to actually document that. A nurse in London did it. Veterans Affairs trying to reach out to that particular subgroup. It's shocking. It's been going on for decades. I've been a street nurse about 23 years. I saw it right from day one. It's way worse, to the point now that I would say that many of the folks you're talking about who are mostly outside are palliative, but without receiving palliative services. Next time you're walking around, what you will see is thin, emaciated, almost like Depression-era images of people's faces, and that's what's there. At TDRC, Toronto Disaster Relief Committee, we argued for emergency rent supplements for that population a few years ago when Mayor Miller was the mayor. By the way, I'm not in any way defending that regime around housing and homelessness in any fashion. We got a few of them, but not enough. But that's one of the immediate ways that people can be housed with supports. by using that rent supplement process while we wait for all the money to come that's in that one paragraph in the Liberal platform for housing. So it's, we should be ashamed of the situation. It's a crisis. There's only a small number of reports that have documented it, and we should end it now, and we can end it now. As Ursula Franklin said, it's a man-made disaster, and we have the legal and technical means to end it. And the City of Toronto, Sean Gadden from the Housing Department is the one that gave me the list of 7 housing projects. I know the folks from Older Women's Network know that. There are only 7 projects that are currently being built and currently being funded, i.e. construction, right now, people moving in. Only 7. That's officially from the City of Toronto. I know there's plans for the Portland, you know, I know there's plans for the future, but right now there's only 7. And how many of those units can house a senior? Not very many. Thank you.
Let's face it, we're one of the richest countries in the world, and we owe it to our seniors and our most vulnerable citizens to look after them. And as part of our platform, we have a plan for, under our health care plan, is better care for seniors, home care, more money for doctors and nurses, and transitional long-term care.
We have added 19 hospitals, expanded 100, and added 10,000 nurses and 3,000 doctors. So the capacity of the system has never been more expanded than it has under this government. After the previous government closed 28 hospitals, and I won't even get into it. We have an aging at home strategy. St. Jude's has doubled. We run a housing clinic for high-needs people every 2 to 3 weeks in my constituency office, and we do this jointly with the city councillors. We have dozens of people go through a month. We have not yet, especially because we deal a lot with frail elderly, not been able to find quality housing for them. Not to say that there isn't a shortage, but so far I found that there is, but I do agree with you, and when we looked at the community plans, we've identified there's about 3 neighborhoods where the services are all either substandard or inadequate. People are living in substandard things. I just want to get through. The Pan Am Village isn't fiction. It's 1,500 affordable units that are now under construction. Regent Park, phase 1 and 2. Wellesley Place was built. The Fife House was built. Woodwood Green was built. The West Dominance 589 King is being built. 60 Richmond East is being built. 501 Adelaide, 92 Carleton, CRC. Aboriginal Nishnawbe homes right now at 244 Church, the YWCA Elm Center, and I could go on. So it's a heck of a lot more than 7. That's a lot more than 7.
We're almost out of time, but I think we'll squeeze one more question and then I'll get everyone to wrap up.
Hi, my name is Everett. I'm a survivor from 200 Wellesley. September is almost 1 year from the fire we had at 200 Wellesley. I could talk a lot on that. But my question is, when they finally let all of us residents return to 200 Wellesley, TCHC publicly announced that your living conditions are going to be improved, they're going to be better. Guess what? This is same old, same old. Joe Fiore did an article in the Star the other day. He's the only guy in the city that's staying